A pleasant morning to each and everyone. Today, we will hear inspiring vignettes from some caregivers of children and youth with special needs. As they said, sometimes real superheroes live in the hearts of small children fighting big battles. So, join me as I acknowledge their unbelievable strength and courage in battling an overwhelming circumstances. I'm Unizel Estuanda, BSNED student, and I will be discussing the struggles in the lives of an individual with hydrocephalus. But first, what is hydrocephalus and how can it affect the children's brain? Everyone has cerebrospinal fluid, or we call it CSF, which circulates around the brain and spinal cord to protect the brain and keep it healthy by removing unnecessary waste products. Cerebrospinal fluid is made constantly by a tissue within the ventricles of the brain. It circulates through the ventricles down to the spinal cord and over the surface of the brain. If a blockage, a problem of reabsorption, or overproduction of CSF occur, the fluid will build up that may cause hydrocephalus. So basically, people with hydrocephalus have excessive amount of CSF. Take note that the term hydrocephalus was derived from the Greek word hydro, which basically means water, and cephalus, which also means head. The reason why 4 years ago it was known as water on the head or water on the brain. According to Dr. Manuel Kakduk, a renowned neurosurgeon in the United States, approximately 1 out of 1,000 poor children suffer from hydrocephalus here in our country, Philippines. The major types of hydrocephalus are: first is communicating hydrocephalus. It occurs when the flow of CSF is blocked after an exit of the ventricles. This form is called communicating because of the CSF can still flow between the ventricles and then the passage between which will remain open. Well, the second one is the non-communicating hydrocephalus. It happens when the flow of CSF is blocked along the more narrow passages connecting the ventricles. Next is the acquired hydrocephalus. It occurs after birth when a tumor or a disease blocks the absorption of cerebrospinal fluid in the brain. And then a serious head injury is also one of its causes. And the last one is the congenital hydrocephalus, which means it is inborn. This is more than 50% of the cases. Also, it is the most common reason for brain surgery in children. The main causes might be the events that occurs during fetal development, or it might be genetic abnormalities, or may include infection from the mother during the pregnancy, such as syphilis, mumps, rubella, or birth defects such as spina bifida. Now, let us discuss some symptoms of hydrocephalus in infants, and these are: first is unusually large head, then vomiting, rapid increase in head size, irritability, poor feeding, poor growth, poor responsiveness to touch, sleepiness, spina bifida, and eyes may also appear to gaze downward. While among older children, symptoms may include headache, poor appetite, poor coordination, unstable balance, so they might fall while standing or walking. Then they also may have blurred or double vision, and then excessive sleepiness, and then change of personality. They might also have delays with previously acquired skills such as walking, and they also have poor temper control, so they easily get mad towards certain things or situations. So hydrocephalus is typically treated by a surgical placement of shunt system. The shunt is placed to be an alternative pathway of the CSF. A shunt is a narrow and flexible tube, and it allows CSF to leave the brain and go somewhere else in the body to get reabsorbed. Because the production of CSF does not and even there is already a build-up. This may require replacement. Outcomes are variable, but many people with shunts live normal lives. Without treatment, death or permanent disability may occur. Now, let us hear an inspiring vignette of a parent's struggle and courage on facing a battle with their child who suffers with hydrocephalus.
Hi, I'm the mother of Paul Jason Villian. He was barely 2 months old when the doctors detected that he had congenital hydrocephalus. Now, he is already 3 years old and his situation has worsened. His head continues to grow bigger and bigger because of the large amount of water inside his head. Jason's case is different from those other children suffering from hydrocephalus. He has multiple congenital anomalies. When he was over a year old, Jason underwent an operation to correct an intestinal malrotation, a medical situation in which the intestines are intertwined with other internal organs. It had been very difficult for the fragile Jason to have such an operation at a very tender age, but he survived. My little boy survived, although it was only the start of his many battles. Since his anal opening was very small, his intestine had to be placed outside his abdomen so he could still digest and discharge waste. He became malnourished because his body could only take in so much milk and infant food. If he ate too much, he would throw up. We already went to National Children's Hospital in Manila 3 years ago after my son underwent 2 operations in Puerto Princesa City. We are advised to go there because the local hospitals lack facilities for operations on children with hydrocephalus. My Jason was too small and weak for another major operation when he was brought to Manila. And we had to go back to Puerto Princesa because we had no money to sustain our stay at the National Children's Hospital. Even if it's free, we went to a lot of friends and other government officials for help just to meet Jason's everyday needs at the hospital. And thank God, everyone was so kind. Jason needs another operation to remove the water from his head. But I'm not sure if this will be the best for my son. Even the doctors here in Palawan cannot assure me a successful operation. This must cost a lot of money, but the family's income? It's not even enough to meet our daily needs. My husband Placido's earning isn't enough. But we vowed to save Jason in every possible way we can, for we see hope. When Jason occasionally whimpers, we feel happy. We are ecstatic when our little boy shows his very rare smile. We get our strength from prayers and hope that one of these days, a successful operation will enable our Jason to live like any other normal child.